So recently at Marissa Faye Wellness, my functional nutrition practice, I've had a couple of clients come in to work with me and my team, one of my associate nutritionists, who have come in with either old lab tests. By the way, it's old if it's over 3 months ago that you did it. And number two, who come in with the wrong lab test. The wrong lab test either for their symptoms or just a lab test that's not super effective. And one of those tests that I've really seen is called GI effects. It's from Genova Diagnostics. And I've noticed a lot of chiropractors run this test. So it must be something that at one point in time has been pushed among that community. But what we're seeing is that while it shows a lot of interesting things about the composition of what's in somebody's gut organism-wise, it lacks a lot of really important markers if you are symptomatic. And you're symptomatic with symptoms that map to a gut issue. If you're dealing with bloating, constipation, diarrhea, skin issues, hormonal acne, eczema, rosacea, you have acid reflux, you have a lot of belching, right? So you have a lot of symptoms that you think like, oh yeah, there's something going on with my digestion, right? But I'm finding that that particular test is not getting people the results that we want them to get, that you want to get, not getting you the remission from those symptoms, not getting you, smooth digestion so that you can go out to dinner with a friend and not have to worry about anything setting your body off, so that you can travel and not have to worry about where the bathroom is or if you're ever going to poop, right? Like, so that you can live your life and, schedule a yoga class and not worry if your reflux is going to act up 2 hours after a meal, right? Like, it's just, that test is not getting people results. So we use a test called the GI map from Diagnostic Solutions. I'm pretty sure that's the lab. My brain just drew a little bit of a blank. And I have just found that it shows me and us the kind of data that's really, really critical and important for people who are having symptoms that show us that their gut is messed up. And we're just not seeing, when we go off of old lab work or other kinds of tests that just don't show us enough about the things that can cause problems, we're just not seeing people make the kind of change that we know is possible. And the key with lab testing, and something you always want to ask if you're working with somebody or if you're running it yourself, the thing that you always want to ask if you're working with somebody or running it yourself when it comes to lab tests is, what am I or we going to do with this data? If you're just doing, or with these data, technically data is a plural word. That's so weird, but it is. If you're just running it to see or to be like, oh, maybe it'll help me with what probiotic to take, that's not a good enough reason to run that test. So, when we run a stool test, when we run a GI map, we are looking for very specific things. And we are looking because of symptoms you have, and we are going to create a custom plan and protocol for you to use and follow that includes changes in what you're eating and not eating, changes in the supplements that you're taking, because so many of you are taking the wrong supplements. We are going to include things like what habits are really, really important for you to engage in, right? What kinds of things are really important for you to avoid in life. For example, I have plenty of clients who, and this has been a big conversation recently, who are doing bedtime procrastination. Is that you? I have done that before at various points in my life, but where you should go to sleep, but you don't want to because you feel like you're burnt out, or so much of your time is not your own, or you're so busy, or maybe you have kids and it's like they finally go to bed and you want to just do what you want to do. But no, like, sleep is so, so important. So I have plenty of people where I'm having to read the riot act on, you've got to get to bed and you've got to make your rest more restful, because scrolling on our phone at night is not restful. Okay. So these are some things you need to be aware of. But when it comes to testing, I'm just going to tell you my official vote is against the GI effects, against the Genova testing. I think if you're going to spend money on a stool test, make sure it's a damn good one, because these tests are not inexpensive and make sure it's going to give you data that you can use or that somebody supporting you can use. And I vote GI map every time.